Today in New York starts now. Coming up next on this Sunday morning, a warning from New York State this week about the dangers of this year's flu virus, and we're joined by an expert from Columbia University telling us how we can avoid it.
No question, there are rising concerns about the flu this weekend after a string of deaths across the country, including in Connecticut and also upstate New York. Joining us now to talk about what you can do to avoid the illness is Stephen Ferrara. He's an assistant professor of nursing at Columbia University Medical and also the associate dean of clinical affairs. Thanks for coming in, Stephen.
Thanks for having me.
A lot of people talking about this. Just that heartbreaking story, that 10-year-old boy from New Caney, Connecticut, who passed away from the flu.
Yeah.
This was a kid who, and I just think of the parents watching, on one day this kid is 10 years old, he's healthy, everything is good, and then he's gone. That's extremely rare.
It is extremely rare. It's not typical of the influenza virus, but it shows you how virulent and how deadly it could be. And one of the greatest things that people can do is get their flu shot.
Absolutely. I want to ask you about that in just a little moment. Right now, give us some context of how this season has compared to those of years past.
Sure.
Obviously, there's a lot of media attention.
Yep.
How serious a concern is
This is quite a serious flu season right now. We usually see the peak right after the holidays. This year, it's really in every state in the United States right now. In all counties in New York State, particularly, influenza is out. It's very virulent, and it's common.
Now, every year we talk about the strength of the vaccine, and there were some reports this year that the vaccine might not be as widespread effective, if you will, than years past. I wonder if that maybe people thought not to get the shot. I imagine you take exception to that.
I do. People still need to get their shot, and what has been shown is that even people who get the flu vaccine and still get the flu, because that is still possible, the symptoms that they get usually are not as severe as if they didn't get a vaccine at all.
So it does help.
It does help. It does help. And we won't really know until the end of the flu season how well of a fit this flu vaccine was. But yes, there's been some reports out there, but still get the flu vaccine. It's very, very important.
And you're talking in terms of the flu season, we really are smack dab in the middle of it. This runs for a couple more months.
It does. Typically peaks around February, March, and it does last. And a lot of people don't know this. Up until May, we could see cases of influenza.
So a vaccine would still be helpful. Some parents might be a little bit hesitant to take their kid into the doctor for fear, that there might be germs in the doctor's office. Is that something they should just contend with, or are there other options?
There are other options. There's lots of places to get influenza vaccines today. There's lots of pharmacies that are offering the flu vaccine where you don't have to go to a traditional office. But a lot of pediatricians' offices have usually a well area and a sick area. So definitely stay to the well area if you're just there getting the influenza vaccine.
And does mom's advice still hold true? Wash your hands, wash your hands, wash your hands?
Absolutely. Stay home. Keep the children at home when they're sick.
Yes.
Don't put them in school. A lot of hand washing, and getting rid of dirty tissues.
Is that, and don't come to work if you're sick.
Absolutely.
if you can,
Absolutely. I mean, it's really, we have to think about this today, but you're spreading your germs throughout the office, and that's not the gift that you want to give your coworkers.
All right, Stephen Ferrara, thanks for coming in. I wish you good health in this season ahead.
You as well.
The time is 10:20. Thank you. The time is 10:25. We're back. Another look at the forecast with Andrea right after this.